restart the recording. Perfect. I'll play driver checks message and we will be right
back. Did you know? DC has performed over 50,000 COVID-19 tests for private organizations and the Ontario government. We have hired over 250 healthcare practitioners to support COVID-19 related projects. We provide more than a test. We provide all the medical expertise around a test, including an expert operations team with experience in a variety of different COVID-19 testing services. DC has even developed a paperless software delivery system for maximum efficiency, including online registration, scheduling, and results delivery. It's time to take control of COVID-19 in your workplace. We're here to help.
Thank you, DC, for your continued support. Now to get to our next seminar. Andrea Morley, Communications and Wellness Coordinator with Healthy Trucker and NAL Insurance, will discuss the repercussions of the COVID-19 virus and lockdowns in both our general population and commercial truck drivers. Andrea will explore how driver health and driver health care have changed over the past 15 months, where it stands currently and where it could head in the future, and what industry needs to do to provide their drivers with the education and resources they need to take care of their health. Andrea works to bring awareness to the importance of driver health, providing a range of education and resources to the industry. Over the past 6 years, Andrea has coached hundreds of drivers and staff to lose thousands of pounds, reduce the need for medication, improve energy levels, and regain their health. I'm now going to queue up Andrea's pre-recorded presentation, and once her presentation is done, we will once again bring Andrea on, this time live, to answer any questions that you may have. Remember, pose these questions in the Q&A drop down in the chat feature, and I will ask Andrea the questions on your behalf when we bring her in at the conclusion of her video. So without any further delay, I'm going to put Andrea's presentation up. Hope you enjoy, and we'll see you back here in roughly 30 minutes.
Good morning, everyone. My name is Andrea Morley, nutritionist and health coach with NAL Insurance and Healthy Trucker. Today, we're going to dive into the topic of COVID-19 and all of the implications that has had on our drivers' health over the past year and a half. So let's get started by talking a little bit about the actual pandemic and the lockdowns that came about as a result. So a lot of restrictions came into place very quickly back in March of 2020. We saw majorly for truck drivers that there was additional isolation put on them who are already a very isolated population. So when drivers head out onto the road, normally they get to go into their terminals, into their customers' buildings, as well as into truck stops in order to talk to anybody that they see on their route. They build relationships with their customers and with their coworkers at their terminals. And when they go into truck stops, they can have a meal with a truck driver and talk to them about their day. But all of these things were completely stripped from them as a result of the pandemic. We also saw that there was restricted use of washrooms, shower facilities, and restaurants, which made it very difficult for them to just go about their day on the road. Healthy food options became further limited to them, which is, of course, something that I'm very interested in talking about. And the effects of this pandemic and the lockdowns were felt mostly by long-haul drivers and those with variable routes and schedules. So if you talk to a driver who is more of a short-haul driver, maybe runs a local route, runs the same route each shift, they will likely tell you that the lockdowns and the pandemic hasn't affected them quite as much as it has affected the other drivers that cross the border, run long haul routes, and are on the road for maybe 1 or 2 weeks at a time. Of course, those are the drivers that have been suffering the most, but that doesn't take away from any suffering or hardships that anyone else has gone through over the past year and a half. It's just really important to recognize that those drivers have faced the most changes for the most part. It's also important to note that these lockdowns are still very much ongoing in a lot of places. For example, in PEI, they really just recently ramped up their restrictions, and they're still requiring their own drivers that live on the island to isolate until they test negative each time they return home to the island. And then there are further restrictions even for those who do not actually live on the island. So this excessive testing has not only been a burden to them, but very stigmatizing. And we will go into that a little bit later as well. So now let's look at truck drivers as essential workers, because we know that trucking has arguably been one of the most essential industries along with healthcare over the last year and a half. If we didn't have those two industries, healthcare and transportation, in place, our country, our world would have basically crumbled. Now, of course, truck drivers face a lot of risks when it came to being these essential workers, having to go out on the road every single day. Truck drivers, of course, face some comorbidities associated with COVID-19 that we'll talk about. And unfortunately, unlike healthcare, they are not trained in infection control. That is not what they studied. That is not normally a part of their job. So suddenly having to wear masks and sanitize and practice this social distancing and all these other aspects of infection control is not something that is part of their normal duties. So it may have been difficult for some of them to implement. And then, of course, their families were put at risk each time that they came home, just because they hadn't been around those people for, say, the last week or two, and you don't know who else they have come in contact with. But then as well, anybody that is at their house may have come into contact with the virus as well, say at their own workplace or in any other things at the grocery store while the truck driver was not at home. So the truck driver and their family may have become a bit of a risk to each other. It wasn't so much that the truck driver was a risk to the family, but they were a risk to each other after not seeing each other for a period of time. Now, let's also look at the role that the media played in this last year and a half. So headlines started to spread right away, spreading fear amongst drivers and the public. But did this help or hinder drivers' situation during the pandemic? Because as we see here below, you can see the headline from the Globe and Mail, which was actually quite recent in January of 2021, that said, "Drivers risk infection and spreading COVID-19 with every shift." But what's important about this is that, is this kind of helping them by saying they're risking infection and they're heading out there on the road, they're doing their jobs, they are essential workers? Or is it blaming the drivers for spreading COVID-19 with every shift? Right? There's two ways to look at this exact quote. And I think it's very important that we remain on the positive side and saying, yeah, they're risking infection, but they're going out there and doing their job. They're doing their absolute best, and we need to support them right now, not blame them for spreading COVID-19 with every shift. Now, social media was also a big part of this pandemic in the past year and a half. So that has fueled a lot of debate amongst truck drivers and the public on pretty much every topic that has come across our screens over these last several months. So, of course, we saw a major divide in our population, whether it was politics, racial inequality, masks, lockdowns, vaccines. Everybody had an opinion, and that created a lot of stress, and that contributed to a lot of the mental health issues that we will continue to discuss. So this is when our mental health absolutely started to plummet. Immediately back in March of 2020, when the media blew up, we saw that we saw the severity of this virus, and that not only started to affect those of us who were maybe working in offices or those of us who were able to work from home, but especially our truck drivers. Now, let's talk a little bit about the actual virus, the comorbidities that these drivers face, the complications with the virus, as well as some physical and mental implications that it caused for them. So the comorbidities that I mentioned a little bit earlier, the comorbidities are things that put drivers at a higher risk of having worse outcomes with COVID-19. So those include obesity, diabetes, high blood pressure, and being of a higher age. We know that people in any of those categories, one or more of those categories, are going to have worse outcomes when it comes to COVID-19. And unfortunately, there is a higher population, a higher proportion of drivers with these pre-existing conditions than the general population. That's something that I discuss regularly in various presentations, and it has become a very important part of my work in this last year and a half, because we see up to twice as many drivers with diabetes, with high blood pressure, as we do without, or as we do, sorry, in the general population of non-drivers. So they have a higher risk of complications from COVID-19. That means that they may be more at risk of having to go to the hospital to get treatment. They may be more at risk of going into the ICU, of having long hauler syndrome, where their symptoms linger on for months and months, even after testing negative, or potentially even higher death rates, unfortunately. Now, did these comorbidities push drivers to improve their health? Because drivers saw, okay, well, if I have diabetes or if I have high blood pressure, I'm going to be more at risk of having a worse outcome. So maybe I should work to improve my health. This, however, only happened on an individual basis. It was not necessarily the case for entire populations in any group or any occupation, because it was very individualized to each person's experience and what they were dealing with, whether it had to do with their job or just their situation at home or their mental health. It was very unique to each individual if they were going to improve their health. Some people did improve their health over the last year and a half and potentially put themselves in a better position if they were to come into contact with the virus. However, other people have really suffered, and their health has suffered as a result. Now, these complications that we talked about, so having these comorbidities puts you at a higher risk of the COVID complications. But then at the same time, we also saw that healthy young individuals were also having these complications, whether it was hospital, ICU, death, or long hauler syndrome. But then we've also seen some vaccine complications popping up as well. And this is a bit of a controversial topic, but I am willing to go here because we do know that vaccine injuries can happen. This is why Canada has now implemented the Vaccine Injury Support Program. And what this means is that the government will, say, provide pay for missed days of work due to COVID vaccine injuries. If, say, you are feeling very sick afterwards, or you have to go to the hospital just to get some treatment after the vaccine, the government has implemented a support program for that, which proves to us that COVID or that vaccine injuries can and do happen. And this means that you may need to support your drivers through their experiences with vaccination. We want them to get vaccinated, but you still need to remember that even after vaccination, they may come across some struggles. Each individual's health is very unique, and they need to make the choice for themselves whether to get vaccinated, how to get vaccinated, when to get vaccinated with their healthcare provider. And then moving on from that, we just need to support them in supporting their health. Now, when it comes to drivers and statistics around who was coming into contact with the virus, who was testing positive, I like to talk about this. This is my favorite part of the presentation because this is where we get to see, were drivers the super spreaders that many accused them of being in the last year? So of course, all those headlines were saying that they risked spreading infection and with every shift, but did that actually mean that they were spreading infection heavily throughout our communities in our country? So let's look at some of the statistics I was able to find. And I do want to note that unfortunately, it was quite difficult to find a lot of statistics on this because we just don't have that information yet, and it hasn't been made public. This all came upon us very, very quickly, and we simply were not ready to gather all the information on specifically truck drivers and case counts with COVID-19. So the information that we do have, an article from the CTA in April of 2021 really urged us to stop singling out truck drivers as a COVID-19 source. And I will back this up with some information. Now, they were able to dig into 35 carriers and get some data on case statistics from drivers. So out of 12,000 drivers, they had reported information that only 60 of those drivers had actually contracted COVID-19, which brings us to a 0.5% since March of 2020. And again, this was in April of 2021. So that shows us very, very low case numbers when it came to truck drivers. And it's also important to note that the majority of those cases came from community spread and not related to their occupation. Now, the Peel region actually did a really good job of keeping tabs on cases by occupation. So from March of 2020 to March 31st, 2021, they saw 40,000 total COVID-19 cases in the Peel region. 10% of those cases were related to the trades, transportation, and equipment operators. Now, only a small percentage of trades, transportation, and equipment operators are actually truck drivers. So let's remember that even though 10% of the total 40,000 cases were in those three sectors, only a smaller percent of those are transportation. I don't have that exact number, but we could say that maybe it was, say, 6%. And then an actual smaller percentage of that are truck drivers themselves. So maybe 4% were actually truck drivers. But again, I don't have those exact numbers, but just trying to show you that it was less than 10 and it was less than that. And then an even smaller percent of truck driver cases were from job-related transmission, just as that CTA article described. The majority were community-based. So they were coming into contact with the virus when they were at home and not on the job. Now, like healthcare, it's also important to note that a disproportionate amount of drivers worked through the pandemic versus other industries. Other industries were able to take time off in order to stay safe, such as personal care and restaurants, hospitality, but truck drivers were not able to do that. They did not have the option to work from home, and they had to go out on the road, just like healthcare workers had to go into their place of work, and that put them at higher risk. So for them to have a much lower than 10% of cases actually shows that they did a relatively good job at preventing the spread in the transportation industry. Also remember that the Peel region and the GTA in general are very transportation heavy regions. So of course, there's going to be a higher number of truck drivers in that region, and that could contribute to even higher numbers. And then, as we talked about before, they don't have the same level of training on infection control as, say, healthcare does, and that could put them at a little bit more of a risk. And that doesn't mean that they're bad at preventing COVID-19 spread. It just means that it's not something that they are trained in. Now, one more study I was able to find was cases by occupation in the state of Washington. So in November of 2020, this was published. So we would have more information if this had been published closer to now, but this is the best that we had. So that was about 6 or 7 months into the pandemic. So this looked at the total number of cases based on how many people were employed in that sector. So that gives us a little bit more proportionate statistics. So healthcare practitioners, they saw that 0.7% of all healthcare practitioners employed in the state of Washington tested positive for COVID-19. Healthcare support was an additional 0.7% of healthcare support workers. So together, that's about 1.4%. And then we see that transportation and material moving not accounted for, but actually had 0.4% of those employees test positive. So that is a much, much lower than the cases that we saw in healthcare. And this is not to say that healthcare was awful in spreading the virus. It's just that, of course, they came into contact with the virus more. And it just shows that truck drivers were not spreading the virus nearly as much as we thought that they were. And then we can see, of course, there were much lower numbers even in office and administration work, because they much more had the option to work at home and to stay a little bit more isolated from others. Now, like healthcare, again, trucking doesn't allow for work from home. So even though all these drivers were going out onto the road in the state of Washington, still only 0.4%, less than 1% of these drivers tested positive. And I think that really goes to show how seriously our drivers took this. Well, I guess not our drivers specifically, but the drivers in Washington. It shows how seriously they took this and how they did their part in not only getting their job done, but preventing the spread of the virus. Now let's look at the occupational risk factors, what really put them at risk for coming into contact with COVID-19, because they're not actually considered to be in the top 15 highest risk occupational groups. They don't work in healthcare, of course. They don't work face-to-face, really close with other people. We were able to streamline a lot of processes so that they weren't having to be face-to-face with other people and doing things a lot more electronically, especially crossing the border. So why was there such a frenzy over, oh my goodness, truck drivers are spreading COVID-19 like wildfire? Well, it was the travel. Travel was, of course, heavily feared at the beginning of this pandemic. But unfortunately, or I guess doesn't either fortunately or unfortunately, travel didn't matter as much once the virus already got to our communities. So we had everybody traveling at the very start of this pandemic in January, February, March of 2020, not just truck drivers. So anybody that was moving around was bringing the virus to all corners of Canada, all corners of our world. And that is really where it began to spread throughout our communities. And as soon as it got to even the smaller communities, it was there to stay in the smaller cities sort of thing. And it really didn't have to do with the truck drivers. Now, case counts, you can see by looking on any region's COVID-19 page that case counts are the lowest, are showing travel as the lowest method of transmission. So that tells us that travel does not need to be feared nearly as much as we thought it did. So again, why the frenzy over truck drivers? It's because they are an easily targeted and alienated group. Maybe it's kind of the blue collar role that they have, or just the general attitude of the public towards truck drivers that we usually see. It was very easy for people to single them out and blame them for the transmission of this virus. Now, what was the cost of these lockdowns and the restrictions and the way that we started to treat our drivers? And I don't say we as in us, because I know as a trucking industry, we were here to support them, but the public. So when it came to mental health and COVID-19, what we really saw was that the pandemic was emphasizing any existing mental health conditions that people had. So those who were struggling with depression and anxiety, maybe PTSD, were the ones who were really going to struggle even more. But at the same time, anybody who has maybe hadn't dealt with mental health conditions in the past, they were even seeing it start to pop up as well. We were seeing that people were having difficulty focusing at work. And that's pretty unfortunate for our truck drivers because, of course, we want them to be as focused as possible when they're on the road. We saw increased mental and physical exhaustion, very scary for our drivers because we want them to be as focused as possible. And fatigue is unfortunately one of the top contributors to collisions on our roads. They faced extreme loneliness at home and on the road, as we talked about at the very beginning. Financial pressures, of course, were top of mind for everybody, including our truck drivers, as well as job security. Some people in the industry had very good job security if they were transporting medical supplies and essential goods, but others did not fare as well in the job security category. A lot of us just felt generalized fear of illness, fear of our loved ones getting sick, fear of having a lack of essentials because of the scarcity that we experienced at the start of the pandemic. And then, as you can see in this chart to the right, we saw a significant decline in our psychological health. And this is depicted by the LifeWorks Mental Health Index that shows us at our baseline here in April of 2020. Up until now, our mental health has significantly declined and our psychological health is almost at the worst it has been since the start of the pandemic, but that is what we saw in January of 2021. We've seen a bit of an improvement with better vaccine rollouts and maybe a light at the end of the tunnel with summer now just about here and potentially loosened restrictions on the horizon. Now, the physical impacts, I would say, aside from somebody coming into contact with the virus, the physical implications may not have been quite as severe as the mental health implications, because we know that we have struggled mentally as a nation, as an industry over this last year, and we know that our drivers have suffered as well. But of course, we saw that less healthy food options were available, and those were already limited. So unfortunately, drivers who were looking to eat healthy on the road, but were wanting to do so by purchasing food on the road because maybe they have longer routes or it's just not realistic for them to bring food with them or to cook their own food in the truck. Unfortunately, that was very difficult for them, and they may have had to resort to more unhealthy food. We also saw that gyms closed, and we do have a lot of truck drivers that like to go to the gym, whether they're on the road and they're able to find a national chain, say a Good Life type gym, or when they get home, they like to go to the gym and work out, but they were no longer able to do that. There was just less access to exercise. Even many of the companies who have built in building gyms, they had to close those down and drivers were not able to use those. Sanitation and cleanliness also became issues when they were not able to use washroom facilities or shower facilities. And this further deteriorates their mental health, which is really important to note because not only is that a physical impact, but it created another mental impact. Now, of course, all of these measures were put into place in order to prevent issues from COVID-19. We didn't want our drivers to become sick with COVID-19. We were trying to keep cases down. So there was a purpose to these lockdowns and the restrictions. However, things like healthy food and exercise could actually contribute potentially to better outcomes when drivers come into contact with the virus. So unfortunately, it is a bit of a double-edged sword, and we just wish that there was a way around that. And maybe in the future we will know better and we can do better. But unfortunately, we didn't see that over the last year and a half. Now, let's see if there were any benefits to their health, because as we've discussed, things were pretty negative over the last year and a half, and we all know that. But there were a few things that were nice to see come across our screens and that we were able to maybe experience a little bit. So, for example, virtual healthcare has become a lot more mainstream, and drivers have really experienced better access to healthcare now that it has moved again more virtual. So before, doctors didn't want to see you over the phone. They didn't want to have an appointment just over the phone with you. That was kind of on just a have to do basis. But now doctors are happy to just have a 10-minute phone call with you and renew your prescription or do whatever they need to do to assess you, because they don't want you coming into the office and spreading COVID-19. So virtual healthcare has been a big benefit that we have seen from this pandemic. And I think drivers will benefit from that for years to come, because of course it's very difficult for drivers to get home and book an appointment, especially not knowing what their schedule might be. So I am happy to see that drivers are now able to access healthcare much, much easier. We also saw that there were a lot more streamlined processes. We did talk about this a little bit before, but where things became a lot more digital and they weren't having to interact with as many people, which maybe saved them a bit of time. Depends on the driver that you ask, of course, but say border crossing, that became a little bit more of a streamlined process, more of a digital process where they weren't having to be face-to-face with customs agents quite as much as before. And then, as we did mention as well, job security for some people, but it's important to note that that was not the case for other truck drivers. We did see a lot of industry support and initiatives. At NAL, we created the Thank a Trucker initiative, where we were able to provide over 1,500 meals to truck drivers last year, which was really great. But we weren't the only ones doing that. There were so many, not only sponsors that were involved in our initiative, but there were so many other companies and people that were creating, whether it was Thank a Trucker named, or just other ways of just getting meals to truck drivers and allowing them to use facilities and do whatever it is that these drivers needed to do, and get parts for their trucks or take a shower on the road. And drivers were offering up their homes to other drivers and making meals for other drivers. So we really did see a major sense of community in this incredible industry. Companies started to offer increased pay for a lot of drivers, which is, of course, fantastic. Some states did offer to provide vaccinations to some truck drivers from Canada. Mental health was brought to the forefront, which is absolutely fantastic. Over the past year, I have done so many more presentations on mental health as compared to physical health. And I think it's absolutely great that we are now talking about this so much more. And then at some times, drivers tell us that they have seen a bit of reduced road traffic. Not always the case, but rush hour maybe isn't quite as bad in the cities, and for delivery drivers, it's a little bit easier for them to get into the grocery stores and deliver groceries and things like that because they don't have to deal with quite as many vehicles on the road. And that obviously would contribute a little bit more to their mental health because they just have a little bit less of that chronic or acute stress caused by traffic. And then it gave a lot of drivers time to focus on their health and their family. So whether they were working or not, some drivers had maybe reduced work hours, or they just didn't have as many responsibilities when they were at home. So that gave them more time to focus on their health and their family. Now, moving forward, let's talk about what we can do to continue to support our drivers as we finish out this pandemic, hopefully, and beyond that. So we have all had a small taste of what drivers experience on the daily. We have been isolated for the past year and a half and not able to see our friends and family nearly as much, or if at all. But that's something that drivers face all the time. So I think it's really important to note that the mental health struggles we have experienced may be something that they are struggling all the time with. Now, as we do move back to a bit of a more normal, hopefully, again, we need to recognize that they will still be dealing with these isolated, difficult lives and schedules, especially if the restrictions don't get lifted for them as quickly as they do for us. If they're still having to get tested and isolate after crossing the border, or say those drivers going to PEI, we need to recognize that they may not be living a normal life quite yet. Also, we need to remember that we do not have long-term data on the long-term effects of COVID-19, those that come into contact with it, information on the vaccines. We are still doing a lot of research in that area. So as we move forward during the next 1, 5, 10 years, we will see a lot more data come out on COVID-19, driver health, those types of statistics. And that means, again, COVID-19 complications, vaccine complications, and mental health complications. We are going to see this over the next many, many years, decades to come. This will be something that that our kids and grandkids and great-grandkids learn about in school. Now, when it comes to employer support and COVID-19, just to leave you with kind of one slide on what you can do for your drivers and your staff members to support them. We have seen through the LifeWorks Morneau Chappelle mental health index that mental health scores are higher when employers offer mental health support in some way. So we do recommend training your managers on recognizing mental health concerns in your drivers and staff. So doing mental health first aid is a fantastic option there. As much as you can, maintain flexibility with their routes, their schedules, wherever possible. And that may not be permanent. It may just mean that they need a 1 or 2 week break from their route that they have been running for a very long time. And just that short break might give them a little bit more time at home, or just that mental break that they need, because repetition, it can become very, very difficult for a lot of people mentally. Now, remember to promote your resources as much as possible. So that's your EAP programs, your benefits, or any other courses and programs that you're able to provide for them or reimburse for them in order to support their mental and physical health. Talk about mental health in your communications, your updates, your meetings as much as possible. Please do not ignore this. And then survey your drivers and employees to see what they need. They know themselves best, and they know what they would like to see offered from you. Doesn't mean that you have to offer it if they request something that is not realistic, but just see what they're looking for and then see if there's a way that you could implement that. And then most importantly, I recommend that you have one-to-one meetings or phone calls to check in with every single one of your drivers or your office staff who may still be working from home. So as much as you can, just get on the phone with them. If you don't normally do that on a regular basis, call them up, ask them how things are, ask them how life is, how their route is, how their job is going, and just see if there's any little thing that you could do to make their life and their job a little bit easier right now. All right, I want to thank all of you for not only listening to this presentation, but for your efforts over the past year, because each of you have been a part of the trucking industry and have helped to deliver all of our essential goods to us and our non-essentials, maybe a little bit of online shopping here and there. And we truly do appreciate all of the work that you and our drivers have done for all of us. I hope that you all continue to take care, stay safe and happy and healthy. I'm going to do a quick Q&A session just after this. So if you have any questions, I would be more than happy to answer them. Thank you.
All right. So thank you, Andrea. If you want to turn your camera on and unmute yourself, we will bring you in for some Q&A. There you are.
Hello.
How are you today?
I'm good. Thank you, Mike. How are you?
Good. So, I mean, thanks for that great and informative presentation. I also want to thank you and the NAL insurance team for everything you've done for the drivers through this pandemic, the Essential Trailer campaign. I know you guys were involved in the free meals that you were providing out at various truck stops, and it was very much appreciated by drivers and a great initiative on your behalf. So thanks for everything you guys have done to work with drivers and thank them and make sure they're getting the recognition they deserve. A couple questions for you. And I think this is important at all times. It's maybe just exacerbated more because of COVID, because if we're not in the proper shape, it does affect our immune system and our health and everything else that goes along with it. But from a diet perspective, what do you want our drivers to do to improve their health in case they do become sick? And I throw in there as well, also maybe from an exercise, because from a COVID, and you touched on it at the start, some people have found ways to exercise and gotten more healthy, but other people haven't found ways to exercise and have actually become the other way. So from diet and exercise, what do you want to see drivers do to improve their overall health so they're not affected by diseases as much when they get sick?
Yeah, so what this last year and a half has taught us is that this virus is very unpredictable. So even if you are in really good health, you may not have a great outcome. It doesn't just have to do with those comorbidities, but if you do have any of those comorbidities, such as obesity, high blood pressure, on a lot of different medications, then we would want you to address your specific comorbidities. So maybe you are overweight or obese, or talking about drivers specifically, we would want those drivers to attempt to lose weight, because that would be attacking one of their comorbidities, or reducing the need for medications, working with their healthcare provider, or a nutritionist or dietitian in order to get them off those medications by reducing the blood pressure, reducing the high cholesterol. That would, of course, help them to fare a little bit better. The way that we would want to do that is by reducing the burden on the body through diet, by eating a lot less a lot more unprocessed foods and less processed foods. And that's going to go for everybody. So of course, we want the people who do have the comorbidities to focus on that. But for absolutely anybody who may be a healthy weight, may not be on any medications, and may not fall into any of those categories, I still want you to be focusing on reducing the burden on your body. So reducing alcohol, reducing processed foods, eating as many whole foods as possible. And the same thing will go for exercise. I want you to be doing, and I want our drivers to be doing, a moderate amount of exercise, doing what helps them to feel good in their body, having some strength, like building muscle, but then at the same time making sure that they have good cardiovascular strength. Going for walks often is going to help, but then also not overdoing it when it comes to exercise, because that can be placing more stress on the body, especially if you do come into contact with the virus. You're going to need to take it easy so that your body can recover.
No, appreciate that. And one thing I took out of that is my increase in alcohol since COVID hit is not a good thing, apparently, and I need to go down on that.
And you know what?
Before.
You're not alone. You're not alone. A lot of people have been in that boat. So maybe now's the time to cut back on that a little bit, but it can be hard in the summer. So
one other question, and then we'll let you go and let people get away to their lunch break. But I know you have a lot of contact with drivers through your role in the job that you do in coaching a lot of these drivers. How have they felt from your view as a result of being kind of isolated throughout this? There was the reports that they're spreading the virus, which we know isn't true. A lot of their jobs in the first place is staying isolated. They don't have a lot of contact with people in the first place because of their job. And then when COVID hit, the interactions they might have had at shippers and receivers was gone. It became paperless. The interactions they might have had at truck stops was gone because the restaurants were closed. And then when they got home, if somebody found out they crossed the border, in a lot of cases, they answered questions honestly, being refused entry to grocery stores, their kids' school, banks. I heard of some drivers, because they were worried about their families, they were staying in their truck even when they got home. So in talking to drivers, what did this do to their mental health that they maybe opened up to you a little bit, that we as a society need to think about a little bit?
Yeah, so I was able to talk to a lot of drivers, not only through my regular job, but as well, you mentioned the Thank a Trucker events that we did last summer, specifically with NAL. And we were able to talk to a lot of drivers there, and we asked them that exact question. How does it feel to be on the road right now? And what are you experiencing? And what a lot of these drivers said was that they felt very isolated, very frustrated, and that was affecting their mental health. And a lot of drivers were having to kind of dive into learning more about their mental health, finding more resources for their mental health, which is something a lot of them had never done before. And then what we also saw was that they had a lot of fear, and that was put into them by the media and other people telling them that they were these super spreaders. And then they were so afraid that they were going to be spreading the virus to their families and their loved ones. So at some of our Thank a Trucker events, we were working with Driver Check when they were doing their testing. So they would have a testing booth set up, and then we would be providing them with meals. And a lot of these drivers would say, I just want to get tested just to make sure that I'm keeping my family safe. And that was really hard to see them struggling. As you said, so many of these drivers were going home and still sleeping in their truck because they were just so afraid to go in their own house. And I think that really speaks to the mental health struggles that a lot of drivers started to experience. And luckily, this entire pandemic has put such a big spotlight on mental health. And that's something that we have now learned we need to focus on a lot more. And we're getting a little bit better at that and providing them those resources.
Yeah, no, for sure. And I think what it also put a spotlight on, there's so much fear out of this disease, so much misinformation, and so much unknown. And let's be honest, what we do know changes 2 months from now as they learn into it more. We need to have a little more patience for what people are undergoing, I think, no matter what profession they're in, and try to understand what their perspective is on things. Because in a lot of cases, it's just the fear of not knowing.
Yes, exactly. The fear of not knowing, the fear of the unknown has been massive for all of us, as well as the misinformation. It is just crazy that's out there, whether it's put out on purpose or by mistake. It's everywhere, and it makes it so much harder to navigate all of this.
Trump's Twitter feed being shut down has helped.
Yes, a little bit. That has created a little less chaos in the Twitter world.
All right. Well, Andrea, we thank you again for your contribution to our conference, for all the work you do with the drivers and for our industry. And a donation will be made on your behalf to the Convoy for Special Olympics. So thank you.
Thank you so much for having me, Mike.
All right. So with that, we will now take a break and reconvene at 1 p.m. for our afternoon sessions. Please take the opportunity to check out our sponsors again on the vendor page and visit their sites. Book appointments with their reps, network with their booth staff. All of these activities will improve your score for the PMTC Networking Challenge, where the top 3 scores will receive Visa gift cards of $300, $125, and $75. And the last time I looked in there, Kimberly Buyback and Sud Malhotra, the rescues have a lot of work to do to catch up with, and they appear to have been pretty active. So lots of time left. Get in there again today. See if you can get in those top 3, and thank our sponsors for sponsoring this event. We will begin again at 1 p.m. sharp with the benchmarking survey sponsored by the Ontario Truck Driving School. I will leave the live feed open So if you do not wish to log out, you don't have to, you can stay here. Otherwise, log out and you can log back in prior to 1 p.m. and click the live feed link from the virtual website on the session schedule. With that, enjoy your lunch and we will see you back here at 1 o'clock. Thank you.